At this moment, we would like to address all the questions you've been typing into the chat, and we really can't thank you enough for your questions. The questions are amazing and really detailed, and we're going to get to it right now. So welcome back, speakers. Thank you very much. Thank you. Appreciate that. All right, now let's take a look at the questions that we have from the crowd. Let's take a look. All right, now the questions are amazing. So again, we thank you very much for putting in the questions since the beginning. Perhaps you'd like to have the questions to be presented to each and every one of the doctors as we are doing it. All right, so every doctor here will have a chance to answer questions. So thank you very much again for your questions. Let's make our way now to the first question. The first question goes to Dr. Bhavesh. Hi, sir. Now, can gut and intestine health tests be done through GPs? It's a good question.
It's a good question. So I know that specialist gastroenterology clinics do offer this, and I think a lot of GPs will come on board. This is science in development, so I think more and more GPs will come on board.
Amazing. Thank you very much, Doctor. All right, next question goes to Dr. Lee. Dr. Lee, now for bone loss and bone building medicines for osteoporosis, now in the past I was told that none of the medicines can be taken for more than a few years at a time. Oh, but now I'm told that this is not true. Can you demystify this?
Yeah, thank you for this question. This is actually pretty wonderful questions. So for osteoporosis, yes, there is one type of the osteoporosis treatment that should not be used for more than, for example, 3 to 5 years because of the possible adverse reactions of causing unusual non-healing of the jaw when you go for the tooth extractions or a certain unusual fracture of the thighs. But actually, first of all, the risk for this unusual fracture or unusual non-healing of the jaw, and the rate, the chances of getting it is very minimal. It's like less than 0.1%. And also, with what we call the drug holiday, or just to hold off the treatment for a short period of time, for example, 1 or 2 years, but in between, your doctor will still monitor your bone mineral density regularly. So this will still help us to continue with the monitoring treatment very well. And also there are nowadays a lot more wonderful treatment for osteoporosis that can be tailored to different needs of different individuals. And some of it can be used continuously.
There you go. Thank you very much for your answer, Dr. Lee. Our next question goes to Dr. Sim. Now, sir, multivitamins typically have a very high vitamin B level, which is many times the RDA, which is the recommended dietary allowance. Now, whilst excess vitamin B will be excreted in the urine, does the consistent vitamin B overload or damage kidneys?
Great to be here. Thanks for the question. I noticed that this question focused on vitamin B. Actually, vitamin B has been shown in some studies to be helpful in kidney stones, but like all vitamins, it should be taken in moderation. So I don't think there are actual studies to look at excessive intake or high levels of vitamin B intake in terms of damage to the kidneys, and I would say that that doesn't need to be done. We have experience for vitamin C and vitamin D studies to show that high levels of vitamin C intake advocated by Linus Pauling in the 70s increases the risk of oxalate production and stone formation. Vitamin D, specifically the components inside, can also potentially increase the risk of stone formation. I would say take in moderation.
So lactose is metabolized or digested in your GI tract from enzymes that are actually on the surface of the small intestine. Now, obviously, as we age, as everything atrophies, and including the digestive system also slows down. So you may find that you may not be able to take the same amount of milk or milk-based products as you were when you were younger. But I wouldn't say that it is necessarily a good thing to reduce your lactose intake as you get older. I think you've got to tailor it to your symptoms. So if you have no symptoms and you can get away with drinking a liter of milk like I do, then go ahead, you know. It's very interesting. I'd just like to add on a point actually that between the three of us, you've seen all the diet charts. I think
drink
the only
the most
safe,
milk.
the only safe thing to do is to drink water. I think
Oh, yeah,
anything
that's
else is not allowed, right?
What Dr. Sim said,
But the truth is that everything in moderation. I think the main message that we want to get across is food in moderation.
Absolutely. All right, now next question goes to Dr. Lee. Now, can I take niacin, which is nicotinic acid, over-the-counter supplements at 500 mg if my LDL profile is high?
All right. So actually, for niacin, if this is the treatment for the elevated or severely elevated triglyceride as prescribed by your doctor, I would say yes, go ahead. But you have to still monitor the cholesterol profile regularly. But if this just for general well-being, I probably feel that there is no such a strong need to do so.
Okay, well answered. Thank you very much, Dr. Lee. Okay, let's take a look at the next question now. It goes to Dr. Sim. Now, sir, is there a risk of taking too much calcium supplements, for example, resulting in deposit in arteries, causing heart issues, kidney stones, etc.?
Okay, so there are actually two questions, one about heart disease and one about kidney stones. I'm going to focus on the kidney stones part, and I would say that based on my earlier charts that I've shown, too much calcium supplements, that means not your dietary calcium, can potentially increase your kidney stone formation. This is shown by the Nursing Health Professional study, whereas the dietary calcium actually functions as a chelator for oxalate and prevents excessive oxalate from absorption.
Thank you very much, sir. Our next question is interesting. Dr. Bhavesh, how do I know if I'm absorbing nutrients from food and supplements well?
I know that's a great question, actually, and it's an interesting question. I think from a patient perspective, when you open your bowels, when you pass motion, and if you see fiber, if you see tomato skin and things like that, then that does not necessarily mean that you're not absorbing your nutrients. I think in a select group of individuals, we do look out for signs of malabsorption. So we're typically looking for their motion consistency. We're looking to see whether their motions float in the water. So they'll come in describing that. They might see when they pass motions, they might see oil droplets in their motions. That might be a sign of malabsorption of their nutrients. But otherwise, generally, most people who pass within the normal range of motion should not have malabsorption.
Thank you very much, sir. Okay, now next question goes to Dr. Lee. Dr. Lee, is frequent burping a cause of concern? Is it a sign that I may have silent reflux? What are the risks associated with silent reflux?
All right. So for frequent burping, sometimes we do experience it on and off, sometimes during stressful periods or when we have a change in the diet. Overall, I think we still have to correlate with our other digestive symptoms or other systemic symptoms as well. But for silent stomach acid reflux, sometimes it might cause even indigestion, bloating in the upper abdomen. Some people may even have hoarseness of the voice, change in the voice. So I think the good way to tackle this, first of all, of course, take a look at your recent diet, see anything that can be modified from there. I think just now there is a FODMAP diet chart that can be very helpful as well. So I think we can take it from there.
Okay, now, Dr. Sim, now for a woman having frequent UTI, is it safe to take a tablet of 50 mg of nitrofurantoin daily for the long term?
Right. So nitrofurantoin is the antibiotic of choice historically for UTI, and there are still some physicians who prescribe it for the prevention or prophylaxis of frequent UTI. In today's context, we often use fosfomycin monoral or cephalexin for a lot of our women with frequent UTI, either on a scheduled basis, regular basis, or preventive prophylaxis basis after intercourse. This is particularly important if the woman is expecting to be pregnant or is pregnant, because these two medications are safe for pregnancy.
Thank you very much, sir. Okay, now, Dr. Bhavesh, how do you prevent or improve gut health issues related to stress, apart from reducing stress?
Yeah, so the obvious one, reducing stress. or coping with stress. I mean, I think, it's more about how we deal with it. I mean, we can't stop stress, but it's how we deal with it. I think, as I showed in my presentation, it's a multifactorial thing. It's related to diet, our sleep, our sort of overall mental well-being. I think all of these play an important part, and I think taking out a single aspect of that is not really going to be helpful. I think doing it in combination is probably the most important. So there isn't a one pill or one solution for this. I think just overall having plenty of fresh fruit, vegetables, getting lots of sleep, lots of fluids, and just meditating and looking after your physical and mental health.
Thank you very much, Dr. Bhavesh. Next question goes to Dr. Lee. Dr. Lee, do statins cause muscle loss? I already struggle with sarcopenia and osteoporosis. I'm really concerned that the statins prescribed for my high cholesterol will make me lose muscle even faster.
Right, so for statins that we use, I would say there is no robust evidence to suggest that, for those who are taking long-term statins, they will suffer from muscle loss. But of course, I would suggest that if there is osteoporosis, of course, there is a strong need for the specific treatment for osteoporosis on its own, and certain exercises like weight-bearing exercises, like Zumba, hiking, or this, that will be good for the bone health and to build up the muscle mass, to tackle the sarcopenia. A well-balanced diet with a sufficient protein intake, and also some strength training exercises will be great to just maintain the muscle mass.
Thank you, Dr. Lee. All right, we're going to make our way to the next question now. It goes to Dr. Sim. I was diagnosed with kidney cysts, but the doctor says there's nothing to worry about. Will these cause issues in future, including kidney failure and cancer?
Okay, so we're kind of departing from kidney stones. Yeah? So there will be certain specific features that your doctor will be looking at when you have kidney cysts. So it ranges from simple kidney cysts, which are something that you don't really have to worry too much about, to complex kidney cysts, which may be a harbinger for kidney cancer. This will require detailed imaging studies, so I can't really comment about your specific kidney cysts. Even for simple cysts, we have large cysts that compresses on the kidney tubes and blood vessels that may affect the kidney function. They can also develop infection, and they can also cause bleeding, especially in patients who have kidney failure or on dialysis, who are frequent users of anticoagulant that may increase the risk of bleeding. So I would say that have a good, proper, comprehensive assessment by your urologist if you have been told you have kidney cysts, to assess your risks of complications.
That's great advice. Thank you, Dr. Sim. The next question, we're going to go to Dr. Lee now. Dr. Lee, for the gut microbiota test and the probiotic recommendation after the test, how applicable it is over time, since the microbiota can change through time? For example, during episodes of food poisoning, antibiotic use, etc. Must the test be done from time to time?
Right. So for the gut microbiome test, for example, if this person has certain health-related concerns, indigestion, issues with mood regulations, having challenges with immunity, etc., so they might consider going through this gut microbiome test, and if necessary, to also receive the precision probiotics treatment and see any response after that. It's not mandatory to have like our cholesterol follow-up, like diabetes follow-up. You have to go through the routine tests regularly, so as to guide your treatment. For the gut microbiome test, yes, if you are during the treatment period, if you're experiencing new concerns, or if the body is not responding to what you have been supplying, or you have been receiving the treatment, then you might be considering just redo the test to see if there is any change in the jungle.
Great, thank you. All right, now next question is very interesting. It's something I wanted to ask since I was a young boy myself. Now, Dr. Sim, any issues with frequent holding urine in the bladder? Will it damage the kidneys, kidney stones? Some of us busy people, no time for toilet. What do you think?
Okay, so for for all of you like out there who like to hold your bladder whilst attending that important business call, just remember that when you hold your bladder beyond your natural capacity, number one, you're going to feel uncomfortable or painful. Number two, the urine is not emptied and there is stagnant urine, and that itself, if repeated over time, increases your risks of ascending urinary tract infection. In fact, I have some patients who travel frequently to some remote parts of the world, and they know that the next toilet stop, official toilet stop, can be a couple of hours away. And some of them will come back and tell me that whenever they go for these long hikes, they will come back with urinary tract infections. I think the increased pressure in the bladder cannot be that beneficial to your kidneys in the sense that it increases the pressure, back pressure potentially, or risk of back pressure potentially to the right, the left, or both kidneys. This is evidenced by patients with chronic bladder outlet obstruction from an enlarged prostate, where the buildup in high pressure in the bladder over time, we're talking about years, eventually leads to kidney failure, and some of these patients present to us with acute kidney failure, and eventually we find out that it's because of all this obstruction, and indirectly they've been holding the urine for a long time.
Oh, that sounds scary. All right, so if you need to go, please go. All right, so it's very important to do that. Our next question, Dr. Bhavesh. Now, I am fasting to manage insulin. How can this affect gut health?
Okay, so again, good question. So you saw from my slides that one of the things that we encourage is to avoid missing your meals, avoid skipping your meals, and have regular meals, right? So that's in the chronic context. So long term, we would not recommend that you do prolonged fasting over a period of, say, more than 2 to 4 weeks' time, right? But short term, actually, studies have shown that you can actually improve certain good bacteria in your gut, particularly bacteria that produce short-chain fatty acids in the stomach, in the intestine. So short-term fasting may not be such a bad idea. Long-term fasting, I don't think it's a good idea.
All right. Well, we heard that from the doctor. All right. So next question, Dr. Lee. How many hours of sleep is enough for a 55-year-old heart bypass patient? Be specific.
Right. So again, there is no one size fits all, but in general, for adults, usually about 7 to 9 hours of sleep, that will be pretty good. But also it depends on different people's, preference or health profile. In some individuals, even 6 hours a day that works for them very well. So I think if that's the case, don't be stressed if you don't hit the 7 to 9 hours.
All right. Thank you, Dr. Lee. All right, now, ladies and gentlemen, next question. Dr. Sim, protein supplements or food containing protein, any contribution to kidney diseases or stones?
Okay, so I think this must be coming from a gym rat who's looking at all his whey protein and protein shakes. So I would say that the most important thing you have to worry about is dehydration or relatively insufficient fluid intake when you take these concentrated protein supplements. Like what I said earlier on, protein intake excessively increases your risk of oxalic production, changes the acidity of the urine, promoting formation of kidney stones. So if you must have that supplement to build up your mass, do it with adequate hydration. Make sure you drink enough for your urine to be clear, and make sure you have enough water.
Thank you, doctor. Okay, now we have time for final 3 questions. Next question, Dr. Bhavesh. We know gut health is very important. How do we choose the correct and right probiotics for oneself, since there's so many manufacturers and brands in the market? Well, he's right.
Yeah, no, absolutely. So look, I think for the majority of us, having any simple probiotics, and to be honest, not even purchasing supplements, having a little bit of yogurt in your diet provides you with good probiotics, okay? And I think that should be enough for the vast majority of us. Now, there are a few individuals who are very troubled by functional symptoms. So they've had tests, they've had endoscopies, colonoscopies, scans, nothing's been found to be abnormal. And in those individuals who we give generic probiotics and they don't work, then I think gut health testing is helpful. There's no point taking one probiotic which may be good for one individual may not necessarily be good for another individual. They may already have plenty of that particular bacterium in their gut, so they may not need that. So I think the way moving forward is going to be individualized gut health testing and probiotics to manage that particular individual.
There you go. Which reminds me, we do have the gut microbiome test, which I've told you earlier about. So grab it while it's still here. All right, now next question, Dr. Lee. How do you reduce body fat? Is there a clinical way to do this?
Right. So
Stop eating.
so how to reduce the body fat? All right. So of course, the first thing that we should be looking at is how is our lifestyle, right? Yeah. So we should embark on review our diet to see if are we taking too much of the sweet beverages. Are we taking too much of the rice noodles, etc.? And for those who loves, certain desserts or certain foods that contains high amount of saturated fat or trans fat, you might want to just modify the diet a bit, and also regular exercises will be so helpful. For general population with no certain medical conditions, usually if you can try to achieve about 2.5 hours of we call moderate intensity of exercises per week. So this can be Zumba, this can be cycling, can be just jogging, or can be working out with your buddies in the gym, just join a class. So there is a lot of ways to do so, but if you're looking at in those who have concerns about weight management and seeking help and to see if there is any medical treatment can be used for. Yes, there are medications available for weight management, but do talk to your doctor to see if there is any indication or whether is there any potential adverse outcomes that might affect you.
Right, thank you very much. Now the final question, Dr. Sim. Now sir, how do you get rid of kidney stones naturally without any medical procedures?
Okay, I think we're looking at a three-part answer to this. The first part consists of 3 words: water, 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 right? And aside from that, we're talking about kidney stones that have already been formed. The second part is in patients with known metabolic stones such as uric acid stones, adjustment of the urine pH through salt solutions. We're talking about alkalinization of the urine can help these patients, but you need to get tested because most of the stones we see are not uric acid stones. The third part is if you have a tiny stones and you want to physically remove it without a surgery, there have been studies where physiotherapists put patients on an inclined bed, head down, and try to cup the back and try to get it out. Wow. But don't do this at home, right? Talk to your doctors about that. That study has been done, but it's not a routine or standard of care.
Thank you very much, sir. All right, so ladies and gentlemen, now we thank you very much for your questions. Now, unfortunately, we can't get to all of them due to time, but we greatly appreciate you for spending your lunchtime with us. This is the final lunchtime segment, for this year, and we hope you found this webinar useful. Now, once again, thank you very much, Dr. Bhavesh. Thank you, Dr. Lee. Thank you, Dr. Sim, for taking time to share with us all about how you take charge of your everyday health.